And joining us now to discuss the viral movement, Dr. Coroey Hebert. Doctor, thank you so much for being here.
Good to be here with you.
And we know patients using Wegovy have been able to reduce body weight by 15%. We were looking at a study out of the University of Alabama finding that overweight and obese users who injected Ozempic weekly lost 37 pounds. If not covered by insurance, though, if used off-label, this is pricey, upwards of $1,300. So at this time, this is a diabetes medication, or in the case of Wegovy, for obesity. It is not for people with normal body weight or BMI who just want to lose a few pounds. Is that right?
Yeah, that's correct. And let's just be very clear here. This medicine was made for people with diabetes, right? But in medicine, we always find new ways to retool a medicine. For example, Viagra was a medicine that was for hypertension. I mean, and we found other ways to use that, right? So the issue becomes, if a medicine is made for a certain thing and you find out that a quote unquote side effect or another effect is something that is marketable, then the drug companies are going to do that. The problem, though, is that that old adage is there's no way to just take a shortcut to lose weight. But when you start looking at these types of medicines, there are shortcuts if you can afford $1,300 out of pocket, which once again goes into the whole concept of who can actually be healthy, meaning if you want to lose weight, do you have to be rich to do that? Or do you have to actually get diabetes and then be able to lose weight? There's so many things at play here. So it's going to be interesting to see how it plays out.
And I do want to talk about a couple of things, one being side effects and also the fact that people who legitimately need this can't get it now. Let's talk about side effects first. It includes pancreatitis. Is that right? I mean, some of these side effects can be fairly serious.
Sure, it can cause problems with your gallbladder. It can cause pancreatitis. It can cause you to decrease your heart rate. It can cause your insulin levels to be all over the place and be wacky. It can cause you to pass out. There's so many things that can happen if you take a medicine and that it's not supposed to be used for when you take that. I mean, there are so many things. You have them listed. I mean, you got vomiting, you got fatigue, you got suicidal behavior. All these things are possibilities of using a medication that is made for diabetics. But, when people are trying to lose weight, I mean, we literally just had a whole concept that came across the web that everybody's talking about, is this, the American Academy of Pediatrics saying that children over the age of 12 should be looking at medicine and surgery to decrease weight. So we have a big problem in the United States with weight gain and not being able to lose it. And over time, either you're going to pay me now or you're going to pay me later, because if everybody is overweight and they have orthopedic surgery, if they need orthopedic surgery, have orthopedic problems rather, if they have a lot of other endocrine or hormonal issues, then that's going to be something that we have to pay for as a country later. So is $1,300 a bad idea when you could decrease the amount of weight on someone so they won't have those other comorbidities associated with obesity? That's a real issue. So once again, it becomes
certainly complex. And Doctor, I'm sorry, we
Sure.
are so short on time, but I do want to make sure that we touch on two things very quickly. Just in about 10 seconds. One TikToker, Remy Bader, she was prescribed Ozempic. She took it. She went off of it and gained double the weight back. Is this something that you have to be on forever in order to see these effects?
The problem with weight loss, quick fix weight loss things, is that if you don't change your dietary habits, when you stop taking the medicine, you are going to gain the weight and gain it back more. So that's why I don't prescribe anything for weight loss until you lose 20% of your body weight at first, because once you change what you're doing, then you can maintain the quick fix.
And doctor, finally, there is a run on these meds. Diabetics cannot find the medication, sometimes for months at a time. And I want to be clear, for them, we're not talking about just potentially losing a few pounds. We're talking about this drug reducing the chances of kidney damage, of heart issues, hearing loss, and stroke. Can you help us understand how serious this is?
Yes, this is the edict that I'm sending out now. If you have diabetes, you should be on this medicine. If you do not have diabetes, you should not be on this medicine. You should find another way, a much more normal, quote unquote, way for you to be able to lose the weight. This is not for you. Once we have a surplus of the medicine, then let's talk about that. But we don't have a surplus now. This is for the people that are sick, not people that want to be having some vanity to lose a little weight, that don't want to stop eating and work out.
All right, Dr. Hebert, really appreciate your time. Thank you so much. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.